Earlier this year, pharmaceutical company Pfizer flagged an oversupply, particularly of Xanax, to Gibraltar. The drug is not prescribed by the NHS due to its potency, which is much stronger than others in this drug family. Before the end of his term in office, Neil Costa spoke to GBC about a number of issues that had faced the Gibraltar Health Services during his time as Health Minister. The oversupply of benzodiazepines was one of them. He agrees the drug has been overprescribed by the GHA, but adds that he has no reason to believe its excessive supply on the rock is indirectly fueling any black market trade of the drug. If you've been at the GHA lately, you may have noticed these leaflets. Benzodiazepines have been prescribed in Gibraltar since the 80s. This is an umbrella term for drugs such as diazepam, lorazepam, clonazepam, tamazepam, and Xanax. Following Pfizer's alert, the GHA is trying to get patients who are using this medication long-term off it. They have been used to treat anxiety and insomnia successfully in the past, but can cause confusion and memory loss as well as addiction. Neil Costa told GBC there's a problem with the overprescription of this drug, adding there were parallels with a recent problem with antibiotics, which was tackled. Dr. Shemaine Taylor will be overseeing patients being taken off this medication.
What's going to happen is the protocol will give guidance to colleagues, and obviously we will try and avoid any new long-term prescriptions of benzodiazepines other than addiction services and mental health team who may need to prescribe long-term in patients who have addiction problems. And the plan is that patients on benzodiazepines will get reviewed regularly by the GP, and the GP will work with them in trying to encourage them to reduce the benzodiazepines. It's not a drug you can stop suddenly. So in people who are not using it every day, then there's no problem with stopping it straight away, because they should not be addicted to it. But the patients who are using it on a daily basis, the reductions would have to be done on a gradual basis, so the patient would be seen on a monthly basis, and they would work with their own doctor to gradually come off it by small amounts, and then reviewed every month. The problem is if folk have been using it or taking this medication on a daily basis, particularly in the elderly, you cannot stop it suddenly. It's quite dangerous, and I think the main message I want to portray to people is that if they're on a benzodiazepine and they're taking it on a daily basis, they are not to stop it suddenly, because they will become quite unwell and they need to go and make an appointment with their own doctors.
The GHA says there are numerous effective and safer treatments available, and to contact your GP if you are on this type of drug long term.